There, and welcome to this setting on. Sorry, good start. Hi there, and welcome to this training session on FOI and EIR in healthcare settings. I'm Steve Durbin. I'm the Director of Exethesia Solutions Limited, and I provide data protection services, including DPO, to these settings. This presentation is obviously not legal advice, but it can be used by anyone else, members of the public, etc., as most of the law is fairly standard. So what we're going to go through is this list here. What's the law? What's it apply to? Why it gets confused with the GDPR subject access right, because it does. And how you deal with them, what exemptions are available, how you can charge fees, how you respond. Some examples, of course, a bit of advertising for us at the end because hey, we need to make money. So what are these laws? Well, they were both brought out quite a long time ago now, and they haven't really changed an awful lot in the interim years. But the Freedom of Information Act 2000 requires that public sector bodies publish certain information. It also requires that you provide it free of charge, and it defines what is a public body. Now, the reason that last one is important is because we have no other definition in UK law of what a public body is, which is used by loads and loads of laws to define what a public body is. However, for medical settings, I have to point out if you had an NHS medical, dental, or ophthalmic or pharmaceutical services contract, you're a public body, whether you like it or not. The EIR also applies to public bodies, but it's slightly different. And first of all, it's restricted to information relating to environmental information, and there are no charges can be levied. So that's the difference between the two laws. So, what does FOI apply to then? Some people say FOI, some people say FOIA, hence the heading. So it applies to organisational information, excluding environmental, because that's in the other act. Duh. It's basically intended to have scrutiny of the public sector. Now, the timeline for delivery starts from the date of receipt, and it's 20 working days. So you can't use an excuse, oh, I didn't read the post, or I didn't read the email. It's 20 working days from the day you receive it. It doesn't apply to personal data. There's specific exemptions for that. So if someone says to me, I want all my personal data under the Freedom of Information Act, you have to go, no, because you're not allowed to do that. The trouble is people quite often confuse the data subject access right law and this law, so we have to be careful and make sure we say to them, but did you actually mean you wanted this instead? So examples of FOIs are down the bottom there. So how many staff received FOI training last year? That would be a valid FOI question. Does your practice have a policy on modern slavery? If so, please supply a copy. Also a valid FOI question. EIR is a lot narrower, and very few healthcare settings will receive EIR requests, but it's a legal requirement, so we have to be aware of them. So it only applies to information the organisation holds about the environment, and again, it's intended to allow public scrutiny. It requires you actively publish some information, as does FOI. So there's things that you have to publish, whether you, no matter what you're doing, and it requires that you answer questions from data about the environment. Again, the timeline is maximum 20 working days. So those at the bottom are valid EIR questions. How much non-recyclable waste did you produce in the last 5 years by year? Does your federation have buildings with asbestos? If so, please provide a list, blah, blah, blah. Those are all valid. So looking at the three laws, okay, Data Protection Act and the UK GDPR, let's go back a bit. Okay, so first of all, there is a third law, which is Data Protection Act, UK GDPR, and the Data Subject Access Right, which is Article 15. Now, Article 15 is all about your personal data. You have to provide, if asked, all the personal data you are processing for a data subject. We have to supply a copy free, but only once. We don't have to supply multiple copies. Okay. After that, we can sometimes charge, but please consult me if I'm working for you as a DPO, because it's never that straightforward. There's always ifs and buts on that. Sometimes people ask under the Data Protection Act, something they don't cause any act. That's all fine. They're all Article 15 requests. If they ask under FOI or EIR, it's a bit more tricky because we have to answer the FOI EIR. So we have to actually say to them, okay, you've asked under FOI for this. I'm refusing it under FOI because it's an exemption. I'll talk about the exemptions later. But I think you meant this, so I'm going to supply it under this, under the data subject access right. Perfectly legitimate. Please don't omit to apply to the FOI because I have had problems in the past with the regulator where they say, well, if you don't reply to both, then it's you're probably not doing your job right. You will sometimes get requests from people where they've got a list of questions, some of which will be FOI, some of which will be EIR, some of which will be EIR. Okay, so just bear in mind the fact that there could be a lot of complexity in this. You may have to answer questions individually. So looking at FOI and EIR then, what do the two acts look like together? Well, basically under the Freedom of Information Act, you've got to make a written request. Under the EIRs, it can be verbal or written, so yeah, people can apply either. Both got 20 working day maximum, both exclude personal data. Obviously, FOI excludes environmental information because the EIR includes environmental information. There's 27 exemptions in FOI. I'm not going to go through all the detail. Most are very rare in healthcare. Okay, there's 14 in the EIR, similarly. We can't generally extend an FOI request unless we are considering a public interest to disclose. That's the only reason generally you can extend it. Environmental information regulations, you can extend to 40 days for a number of reasons. Okay, so there's a few reasons why you can extend there. You can charge a fee under FOI in some rare circumstances. I'll talk about a bit later. EIR, you can't charge a fee. So obviously, clarification on either of them pauses the clock, but also therefore a fee notice can pause the clock on FOI. So let's have a look and see if you've understood that bit. Okay, so someone's sent us this request. Okay, I would point out all examples I use in all of my presentations are real world. I do not make stuff up. I don't need to. There's plenty out there. So someone has stated, I wish to receive all my data, including but not limited to the full detail of my medical record, any correspondence between the practice and myself, minutes of any internal meetings related to me, any internal correspondence related to policy on the treatment of Ehlers-Danlos syndrome, any correspondence back to ITB relating regarding funding of EDS treatment, any environmental noise complaint records of the practice area, including correspondence on the matters. Why? Who knows? But there you are. Any other nuisance complaint records, and I want to receive it under FOI within 28 days. Right. So if we take these apart and go through them individually, okay, the first one is asking for personal data. That's clearly Data Protection Act GDPR. Correspondence between the practice and myself, that's personal information as well. Note that you can't refuse to give someone a copy of the information because they've already got a copy of it because they've been involved in the correspondence. You have to provide them with a copy. Minutes of any internal meetings related to me, well, you may well provide extracts from those. You probably wouldn't provide the full meetings. It's quite likely you'd be discussing other patients in the meeting, so you can just extract those. One thing we get quite often these days with the rise of AI is that people are asking for all the data, including all the metadata and stuff like that. That doesn't apply under DPA. It does in some circumstances under FOI, but not under DPA, GDPR. Any internal correspondence related to policy on treatment of EDS, that would be an FOI. You can look at policy, not personal data. Any correspondence with practice ITB regarding funding of EDS, again, that wouldn't be personal data, so that would be an FOI. And then the other two are clearly environmental noise complaints. And someone said, and at the end it says, I expect procedures under FOI within 28 days. Well, you're going to receive the FOI within 20 working days, which may be 28 days. It depends what time of when it was received. Okay, and the others you're going to receive under the EIR and 20 working days, but under the Data Protection Act GDPR, it's 1 calendar month. Okay, so bear in mind if you get something like that, you have to split this up into bits and answer the bits individually. You can't just do it all under one law, and that's very important. So how do we handle an FOI request? Well, first of all, confirm it's an FOI. We need to work out what data is needed. We need to check if exemptions apply. I'll talk about those in a minute. Check if a fee is needed. If so, wait for the payment on it. Now, the fee regulations are quite complicated. I'm not going to go into them here. Please consult on it. But effectively, if it costs more than £400, then you can charge a fee and not provide unless a fee is paid. The requester can modify their request to reduce the size of it to bring it under £400. So if you're saying 5 years worth costs £400, they can quite happily say, well, I'll have 4 years worth, then that's got to be less than £400. That's legal. Okay. The charges for work that you do, I'll talk about in a bit more detail later. But pull it all together in the form requested and redact it. Sometimes you need to redact things to protect other information about people generally and stuff like that, but under the exemptions, and then send it off. EIR is very simple, very much simpler. The only difference is there's no fee allowed. Also, don't forget that can be done in done verbally and not just in writing. Okay, but that's pretty much the only difference. So when we get one, okay, so first of all, confirm if we have got a genuine FOI or EIR. Is it personal data with request? And it's probably a subject access request. Therefore, it's not an FOI, but we need possibly to tell them we're not answering this FOI. Is it about any of these items? State of the environment, substances, energy, noise, pollution, waste, policies about environment, reports on the environment, health and safety of the public, including food contamination, all that's under EIR. Anything else is under FOI. So when we're determining what data is needed, okay, it's the same process generally for both sets of legislation. There's one extra step for a fee. So first thing, check we don't already publish it, or if it's available by other means, even for a fee. So you don't have to give people information that's already published because they can get it themselves. You may have to point them to it. You do not have to provide information that can be obtained elsewhere, even if they have to pay to get it. That's the law. So be very clear on that one. A lot of people provide information they don't need to because they don't recognise that piece. Check there's not a blanket exemption on release. There are some things which have got blanket exemptions, so parliamentary process, stuff like this. Okay, but they generally won't come up in GP land very much. And check if the cost of providing exceeds the fee limit. Bear in mind you can't include redaction time in that. Okay, for EIR, it's we need to do two separate things. Okay, so we need to confirm that we or deny if we hold the data. So this is both right. That's right. If FOI and EIR, and then we need to provide or not provide the data. Now, the exemptions apply separately to those two things. So it's quite possible and actually common sometimes to have something where we confirm we hold the data, but it's exempt, so we're not going to provide it. But you have to answer the question about providing it separately. So bear that in mind. Okay. So obviously the exemptions vary quite a lot. Okay, so we're going to treat those slightly separately, but the laws are fairly parallel other than this. Okay, and bear in mind confirm or deny may be separate. So the first key exemption, and the one that always comes up, is section 40, personal information. Now section 40 divides things into two different bits. So section 41 is the data of the data subject. That's absolutely exempt. Okay, and we don't need to confirm or deny because it's under the subject access request. Duh. So they just have to apply for that under different law. Section 42 is where it's someone else's data. Now we do need to confirm or deny if we hold it, but whether we release it depends on other tests. So does it contravene the data protection principle? Has the data subject objected? Would we release it if the data subject had requested it? Now, with this, we can also apply a public interest test. So, for example, you can very clearly argue that the expenses of the GPs, okay, are personal data, very clearly. Okay. However, there may be a public interest in releasing that in order to show that GP practices are performing due diligence. So we'd have to consider that. Now, I strongly recommend you consult your DPO on this one because it's one of those areas where the balancing tests can be quite difficult. It's best if someone independent reviews it for you. So what other exemptions are there under FOI? Well, like I say, there's quite a lot of them, so I'm not going to go into all of them. Okay, but section 21, accessible by other means, I've already mentioned. Okay, if they can get it anywhere else, even for a fee, then they must use those other means. Now, a common example here is things like the land registry. The land registry keeps data about every single property ownership in the UK and land ownership, obviously. Okay, they charge a fee for accessing. So if people are asking you about ownership of property, then you just say no, go to the land registry. You don't have to answer that question. There's also things around Section 38, so health and safety. So where disclosure could possibly harm someone. That's not common, but it does happen. Section 42 is very common, legal professional privileges. You don't have to disclose any legal advice you have received from legal professionals. Okay, that's always exempt. So basically, if someone asks for your legal advice that led you to doing something, you can just say no. And obviously environmental information is excluded because it's under EIR. There are many other exceptions. Basically, if you're not comfortable about releasing something, okay, please talk to your DBO and see whether or not there is an exemption, because it's quite possible there is. Now, calculating the fee. Now, the first thing is you can only calculate the fee excluding redaction. There's an odd reason for that, okay, which I won't go into, but you can charge for redaction if the overall calculation is over the limit. So you have to effectively do two calculations. You can charge staff time at £25 per hour. There's this regulation about that. Okay, so that means if it's over 18 hours, okay, because £400 is the appropriate limit, then it's going to be a fee. You can include things like finding record costs and photocopying costs, but they can't be excessive. So you need to look very carefully at whether or not you're doing things correctly and you're filing things correctly. If it's difficult to find, you don't file it properly, the ICO may take a very dim view of that. There was a famous case a few years ago regarding the filming of Doctor Who, which I was involved in, where basically the organisation involved had not taken a great deal of care about filing things about the permissions and stuff like that, because they never thought they'd need it. And the FOI request came in. They said it was too expensive. The ICO said, no, it ain't. So these things happen. Okay. Bear in mind when you issue a fee notice, the clock stops. Okay, so until they either decide if they're going to pay the fee or they're going to revise the FOI, the clock stops. Note if they decide to revise it, the clock doesn't start again at 0, it starts again at the point it was stopped. So please don't delay getting fee notice out, because it's your own time you're wasting, really. So EIR key exemptions. Obviously, EIR also excludes personal data of the data subject, but it also excludes personal data of others. But again, there's a public interest test. It excludes work in progress. That's where you're going to publish something, but it's not ready yet. You can't delay for a very long time. Okay, but what you can do is you can say that I'm going to hold this for a bit because we're going to be publishing it next month, that sort of thing. There's also an exemption where you've tried to clarify, okay, and basically you couldn't work out what the requester wanted. Obviously, you've got to try to clarify, but bear that in mind. It happens more with EIR than just FOI. There's similar exemptions for FOI, but under EIR, quite often people don't know what they're asking, or they're asking for things which don't exist. So whether or not you've done an electrosensitivity assessment and stuff like that, well, we don't do them because they don't exist. So, but you will get requests like that. So once you've done that bit, okay, basically they get back into parallel again, because the laws are very similar after that. So you've confirmed it, you've determined what data it is, you've checked exemptions, checked the fee, put it all together in form requested, redact and send. So let's talk about redaction. It's very similar to the process for a subject access request. If you've done that, okay, and I've got spreadsheets to record redactions if you're one of my customers. You don't give the requester the redaction list, but you've got to tell them what you've redacted and why. There may be things where you redacted it and you're not required to confirm it as well, so therefore you wouldn't be telling them you've redacted, because you're not required to confirm. So I've got a procedure for this, okay, which is very detailed, goes into it, and I'm very happy to share that with customers if you haven't already got it. So once you've done all that, okay, you can send it. You don't need to send this stuff securely. Why? Because it's now public data. Now, we sometimes get requests from websites such as whatdotheyknow.com. So long as the person is using a identifiable address, and there's a bit of case law about this, whether it has to be a real address or whether you have to respond to Mickey Mouse if Mickey Mouse asks. Okay, but please talk to me about that if you get one of those. But you should be replying to them. And actually, because they then publish it on their website, it saves you having to reply to them again, because it's now published. Okay, but it's also a good idea to publish in full on your own website if you can, to avoid future requests. So let's have a bit of a knowledge check. Obviously, you're not in the room, so I can't ask you physically. But here's an FOI, and this, like I say, all these are genuine. This is what I received. In slightly different context, granted. Please supply with all the addresses of properties owned by the practice. Okay, so it's a group practice with their rateable value and energy performance rating. Right, is it FOI or EIR? Is the first question. Is the information available elsewhere, even for a fee? And what's the response to it? Okay, so if we split this into 3 bits, okay, so the first thing is addresses of the properties owned by the practice. That's the first question. The second one is the rateable value of those addresses. And the third is the energy performance rating of those practices. Now, the first one is available at other means. You can get that from the land registry. So therefore, the answer is go and ask the land registry and pay their fee. The second one, the rateable value, is published online because your local authority publishes it. But you'd have to point them to that and say, it's over here. You can't just say, no, I'm not giving you this because it's published. The third one, energy performance rating, again is published. There's a Gov.uk site for this. But again, you'd have to signpost people to it. So the answer to all of that would be, we're not providing this, go elsewhere. But we'd have to answer the FOI and EIR request. We cannot just ignore them. So, as I've emphasised all the way through this, your DPO is here for you. That's what part of my job, to help you with FOI and EIR requests. If you're one of my customers, you can email me at the DPO contact email that's been given to you. Okay, you can also call me on the phone numbers given. You can also call my mobile, including out of hours if it's urgent. It's never going to be urgent for FOI, honestly. Okay, you've always got 20 days, so don't worry too much about that. But it's still there. Bear in mind the service is paid as a fixed charge. There's no direct cost for use. You don't pay extra for calling me. If you're not a customer, then please feel free to email sales@extra3.solutions and see if you want to become a customer. We offer services to many sectors. Most of our customers are in schools and healthcare, but we've previously done work for local authorities. We've also done work for other public bodies as well. Bearing in mind that these rules don't apply to non-public bodies anyway. Obviously, we do data protection as well, and that applies to everyone, and we provide services in that area. So please don't panic, give us a call. So thank you very much for your attention. I hope that was useful to you. And we shall talk to you all soon and see you again. Bye-bye. Bye.